Hello, dear students. I hope you are doing well. I am Associate Professor of Department of Human Anatomy and Medical Terminology of Azerbaijan Medical University, Anar Abdullayev, and the topic of our today's lecture is the history of the development of topographic anatomy as a subject of the study, purpose, objectives, research methods, the value of topographic anatomy in the examination of surgical diseases and the providing of the surgical operations, holotopy, skeletotopy, and the syntopy of organs, vascularization and innervation of the organs, patterns and the features of the lymphatic system. Traditionally, I have prepared the plan of our lecture. The first part of our lecture will devote the aim and objectives of the topographic anatomy. Second part, I'll talk about the investigation methods in topographic anatomy. And the third part, the concept of the regions. The topographic anatomy, the three main approaches to studying the anatomy are regional, systemic, and clinical or applied, reflecting the body's organization and the priorities and the purposes for studying it. Yes, you are familiar with the systemic anatomy because you have studied the anatomy by systemic way. For example, digestive system, joint system, respiratory system. Topographic anatomy is an applied science that studies the mutual arrangement of organs in different areas of the body, their relation to each other, not by systems like the systemic anatomy, by regions. Each region, the main body, is divided into the parts, head part, trunk part. Trunk also has several subdivisions like the chest, abdomen, and the back. Also the upper and the lower limbs. It means that this subject is more close to the clinic because it studies the parts of body with all structures of the concerned region, with bones, muscles, of course the fascia. The last one is very important in the topographic anatomy, nerves, nerve trunks, and also great and small vessels. By synthesizing the anatomical knowledge, it gives the clear idea of the relationship of organs and the connections of some organs with other, neighboring and distant, and therefore is the foundation that allows you to practically solve complex problems of diagnosis and treatment of various diseases. I have to note, as an independent discipline, the topographic anatomy received its development much later than normal or descriptive anatomy, because the normal anatomy, the main method, not the old method, but the main method is description, because I've called it descriptive anatomy. Since the study of the details of the relationship of organs naturally required more accurate knowledge of their structure. Topographic anatomy initially the this subject was called the surgical anatomy. Surgical anatomy. In this picture, you are looking at the academic dissection scene, where the lecturer, you are looking, seated in his high chair, reads the text, and the other tensor demonstrates the anatomy, and the barber surgeon section carries out the dissection. The very interesting picture, which is belong to the period of development of modern anatomy, and the development of the modern anatomy has the great connection with the name of Andreas Vesalius. But now you have to know, by development of the medicine, the doctors, especially surgeons, needed more and more detailed information about the modifications, variations of the vascular nervous structures of concerned region, also the fascicles of these vessels and the nerves, and of course by the methods of the surgical operations on these regions. Not only description of the systems separately, especially digestive, respiratory system, urinary system, genital system. Yes, you have studied these disciplines, these parts of the systemic anatomy, but even at those time, your teachers noted that all these structures also have the vascular nervous structures. They are located within the great connection with the other organs, and you have realized that for the more and the more detailed knowledge, you have to study also these organs in great complex with the other organs. The appearance of essays on surgical anatomy was the answer to the request of the practitioners, primarily surgeons, who needed such anatomical information that would help them in their practice. However, the first writings on surgical anatomy, which appeared in the 18th century, differed little from those on descriptive anatomy. Only at the end of the 18th and the beginning of the 19th centuries, separate monographs began to appear devoted to the description of topographic anatomy and the topographic and anatomical relationships in various areas of the human body. You have to know the word topographic comes from two Greek words. Topos, it is translated as place, and graphos, draw or write. I am drawing or I am writing the place. Of course, under the word of place, we are concerning the areas of the human body, not the place of, for example, nature. The place of the human body, regions. And topographic anatomy studies the mutual arrangement of tissues and organs in regions and their anatomical connections with other organs and tissues, and with the central nervous system. Of course, it's the very great and at the same time very difficult problem. To solve these problems, a number of methods are applied. Yes, in many cases, these methods are similar with the methods of the normal or descriptive anatomy. But topographic anatomy has its own special methods. First of all, the method of layer by layer study of tissues. This method of layer by layer study of tissues in conditionally limited areas is especially important. The use of this method is dictated, of course, by the practical need. At the beginning part of our lecture, I noted that the topographic anatomy is more close to the clinical disciplines. And firstly, it's to give the doctor the opportunity to accurately determine the localization of certain pathological changes. And secondly, to give precise landmarks during surgical interventions in which the tissues have to be dissected from the surface to the depth and the strict layers. It's very important, very important, especially landmarks. When you have studied the descriptive anatomy, your teachers especially noted the very prominent body structures like the clavicle, or for example jugular notch of the sternum, or the mental protuberance, or the scapular spine, or the iliac crest. Why? Because they are important landmarks for providing operations, but not only operations, of course, just for palpation, just for the medical investigation, medical examination of the human body of a living man. And the tasks of the practical study of topographic anatomy are, first of all, to give a layer by layer description of the areas. What is area? Areas in topographic anatomy are the parts of the body delimited from each other by natural or artificial conditional lines. For example, the lateral region of the face, especially now by development of the plastic surgery or aesthetic surgery, aesthetics or the plastic surgeons, they have differentiated, they have determined between the lateral part of the face and the central of the part of the face, the structures, especially fat tissue forming the superficial muscular aponeurotic system of the face, SMAS. It is different in different parts of the face, dividing of the face to the lateral side. Especially you have to know it because you are future stomatologist, you are future plastic surgeons, you have to know. And this subject very detailed. And also the anterior region of the thigh is also very important. And in this picture you are looking at the main landmarks of the human body. For example, you are looking at the sternum. I have noted the jugular notch, which is very important during palpation, during the examination of the human body. Angulus between the manubrium sterni and the body of the sternum. Xiphoid process, which is very important landmark, also is very important landmark, very important anatomical structure during providing several emergency processes in the human body. Of course, the costal arch, which is formed by the ribs of the false ribs mainly. They are connected to the seventh rib of the same side and form the costal arch. And you know, several organs, the palpation of these organs and the relation to the costal arch is very important. If the organ is pathologically enlarged, it's easily palpated under the costal arch. For example, liver. As you know, the location this organ under the costal arch, maybe it's normal up to 6 or 7 years, but then this organ cannot be palpated under the costal arch. Normally it has to locate the superiorly than the costal arch. And about these natural boundaries, not artificial or conditional boundaries. Natural boundaries are folds of the skin. For example, inguinal skin fold, or the bony ridges, for example, iliac crest, clavicle. From everything between the above, the difference between the topographic anatomy and so-called the normal or descriptive anatomy is clear. The latter describes the organs by systems. For example, the system of organs of circulation, while topographic anatomy describes the mutual arrangement of organs by regions. The topographic anatomy carries out the synthesis of anatomical knowledge, while normal anatomy is a predominantly analyzing science, studying individual systems and, of course, the internal structure of individual organs. Regional anatomy or topographical anatomy considers the organization of the human body as mere parts or segments. A main body consisting of the head, neck and trunk. Of course, I have noted this. The last one, trunk, subdivided into thorax or chest, abdomen, back and the pelvis perineal regions, and paired upper limbs and lower limbs. You are looking at the main three approaches to the study of the human nature: systematical, regional and topographical. In many cases, the last two approaches have to be considered like the one. The studying of the human body by regions. During this process, you will use the topographical method of investigation. And in this picture, you are looking at the systematical approach to study of the human structure. Skeletal system, for example, muscular system, circulatory system, nervous system, digestive, Again, the respiratory system, urinary system, urogenital apparatus, male and the female urogenital apparatus. It's a systematical approach, and you are looking to the opposite side, the regional approach to the study of the human structure. There is no systematic way. You are studying the human body here by the regions, dividing of the face into the regions, for example, orbital regio, nasal regio, infraorbital, zygomatic regio, parotid mesenteric regio, and so on. And this picture, which is devoted to the dividing of human abdomen into the epigastrium, mesogastrium, and the hypogastrium, to these regions, and upper limb, which is divided into the deltoid region and the parts of the forearm. Please attention, for example, on the upper limb, in the systematic way, we have used the terms, the classification into the shoulder girdle and the free part of the upper limb, but the regional approach is more detailed. It also divides the shoulder regio into the deltoid, scapular regio, and the arm regio is dividing into the several parts, because it's mainly requirements of the surgical practice. Surgeons, they need it. The more and the more exact information about the considered region. All the major parts may be further subdivided into areas and regions. Regional anatomy is the method of studying the body structure by focusing attention on a specific part, head, area, the face, or region, the orbital or eye region, examining the arrangement and relationships of the various systemic structures, for example, muscles, nerves, arteries within it, and then usually continuing to study adjacent regions in an ordered sequence. Regional anatomy also recognizes the body's organization by layers: skin, of course, the subcutaneous tissue, and deep fascia, covering the deeper structures or muscles, skeleton, and the cavities, which contain the viscera. Yes, of course, we will talk about the fascia, and during all our future lectures, we will study the fascia of the considered region. By this way, we have to know many things, many things, because the fascia, it provides the covering of muscular system, but also it covers the main vascular and nervous structures of this region, mainly form for them the sheath or vagina to these structures, and to be protecting it. Many of these deeper structures are partially evident beneath the body's outer covering and may be studied and examined in living individuals via surface anatomy. Yes, the surface anatomy is an essential part of the study of the regional anatomy, because the all deeper structures are projected to the body surface, and in many cases they are innervated by the same structures, for example by the same spinal nerves of the concerned region. And of course the pain during the pathological processes is radiated to the body surface. Of course, it creates many difficulties and several mistakes in the doctoral practice. But you have to know the studying of the surface anatomy and the features of this radiation is important, very important. Surface anatomy is integrated into each chapter of our lecture and the book in the surface anatomy sections that provide the knowledge of what lies under the skin and what structures are perceptible to touch, palpable in the living body, at rest and in the action. We can learn much by observing the external form and the surface of the body, and by observing or feeling the superficial aspects of structures beneath its surface. The aim of this method is to visualize the distinct mental images of structures that confer contour of the surface are palpable beneath it, and in clinical practice to distinguish any unusual or abnormal findings. In short, the surface anatomy requires a thorough understanding of the anatomy of the structures beneath the surface. In people with, for example, stab wounds, a physician must be able to visualize the deep structures that may be injured. You are looking at the region. I've explained the, for example, deltoid region and the groove between the pectoral and the deltoid region with the sulcus deltoid pectoralis, which contains the vena cephalica, the main superficial vein of the upper limb, region of the biceps brachii, cubital fossa, and the passing of the main vessels and the nerves of the brachial region, such as the nervus medianus, arteria brachialis, with the two vena brachialis. They are enclosed in the special vagina, which is formed by the fascia, of course. And the main function of the fascia not only covering the muscular structures but also the vascular and the nervous structures of the concerned region. As I have noted, the topographical anatomy is a science about the dimensional structure of healthy human body organs, tissues, and the parts of the body. We are looking at these preparations. The muscular elements are retained with the several internal organ structures and the nervous structures. This is topography. The mutual arrangements of the organs, which are by systemic way, are belong to the different systems, but they are located at the same place, and you are, as a doctors, as a future doctors, must learn them together. It's the very important way. You have to learn them together because we can't operate the, for example, separate the skin or underlying structures. All of them form the concerned region, special certain region. And if you will deal with the this region, you have to study all these structures. And as I have noted, you have to study and then cut them layer by layer. This is the main method of the topographic anatomy. Topographical approach to the study of the human structure. Yes, we use the same planes and axes for the studying by topographical way of human body organization. You have been informed about the median plane, about the sagittal plane, about the frontal plane and their axis. And it is the good way and the good time for using these terms. And now the clinical anatomy, very important and a very interesting subject. Main part of this subject is formed by the topographic anatomy. Yes, by the Harold Ellis, by the Moore, Snell, and et al., the clinical anatomy is explained like an integrative science which comprises the topographical, regional, radiological, surgical, and the others approaches to the study of human structure in application to clinics. And the term clinical anatomy, of course you know what's the anatomy. It's the cutting, the method of the anatomy, but not only one method. The main method, it is the dissection. But the term the clinicos means the pertaining to a bed. The clinic is an establishment, where patients are admitted for special study and treatment by a group of physicians practicing medicine together. Like our subject, introduction to our subject, introduction to topographic anatomy. This subject is concerned the studying together of the organs which are belong to the different systems. As I have noted, the topographic anatomy, the study of the morphological structure of the different regions of the human body. Topos place and the graph I write or I draw, and topographic or the regional anatomy. In this picture you are looking at the location, at the mutual arrangement of the many organs together. Methods of the studying of the human structure. Yes, for understanding, especially, for example, internal organs, they have the deeper localization than the other structures like the muscles or of course the joints. These deeper structures, visceral structures of the human body, we can investigate by the syntopic, skeletotopic, and the holotopic way. Or simply saying, each organ has the relation to the skeleton, has the relation to the concerned region, and has the relation to the neighboring organs, and not only organs in our traditional understanding, also to the vessels, nerves, etc. Syntope, from Greek, syn, it means the with, together, and the topos, of course, the place, the position of the organ, with others in any cavity. I mean the main cavities of the human body, like the pectoral or the thoracic cavity, abdominal cavity, and the pelvic cavity. Skeletotopy, from the words, the skeleton, the bony foundation of the human body, and of course again the topos, place, the position of the organ with the skeleton or according to the skeleton. For example, we can say the cardiac orifice of the stomach is located at the level of the 10th, 11th thoracic vertebrae, at the left side of these vertebrae, of course. Or pyloric orifice is located at the level of the 12th thoracic and the first lumbar vertebrae at the right side. At the right side. It's the skeletopy. And also, I can note the stomach is located in the epigastrial and the left hypochondrial regions. It's the explanation of the stomach. It's syncope of stomach. Syncope of the stomach. And the holotopy, for example, stomach, anterior part mainly is closed, is in the contact with the left lobe of the liver, or the fundus or fornix of the stomach is in the contact with the spleen. Posteriorly is in contact with the left kidney and the left suprarenal gland. It's the it's syncope, relation of the stomach to the neighboring close organs. We are using these three methods for definition, for determination of the internal organs: syncope, skeletotopy, and the holotopy. Okay. For understanding the structures, we have to use the methods, like the first of all dissection. Dissection it's the unique method, very interesting method. Only by this method we can get the very exact information about the organization of organs, about the organization of the human body. Cutting up, dissection. And from the lectures of first semester that this process has the very great and difficult way of development, beginning from the early periods during the time of the Andreas Vesalius, and about the problems of the first modern anatomists like the Vesalius and the others, Bartolomeo Yevstachy, for example. All of them had the many problems for the using the dissection methods. But then the dissection method also got its place in the medicine. But for understanding of the mutual arrangement of organs, just only dissection was not enough. Why? Because yes, in the examination of the human body by anatomical way, for example, you are interested in the direction or in the way of the several nerves. For example, medianus nerve. You will cut the skin, you will cut the subcutaneous tissue. Also, you can cut and separate the several muscles because you are interested in this nerve, medianus nerve. But in the topographic anatomy, it's not enough. Why? We are not interested only in medianus nerve. We are interested in the relation of this nerve of to the other structures. And by traditional way of the cutting, by dissection, we can't get to our destination point. And by this way, the method cuts Pirogov on the icy or the frozen cadavers, because when the temperature is very low, actually the cadaver is frozen. During cutting, by getting the special slices, if you want the special plates, very thin if you want, or with the certain thickness, you are looking at the whole part together. The frozen method, the method of the ice sculpture, if you want, because this method is called by the name of the Pirogov, the founder of the military medicine. He was the military doctor, and also is one of the founders of the modern topographic anatomy. Russian surgeon and the topographic anatomist. The method of the ice sculpture Pirogov is designed on the frozen corpse of a separate body by removing all excess tissues using chisel and hammer. And the method of injections also can be used, because the several contrast material, they have to be injected into the vascular system of the cadaver, of course, after removing all other structure, after cleaning, after washing all the blood system. The contrast material is injected to the vascular system, and this material fills the all vessels, and they are branches of certain region. Of course, this is a very interesting method, and after the injection, you can learn this preparation. For example, by the MRI, by the new methods, or CT, computer tomography, or by the simple X-ray. Yes, this method has the several problems, because by using of this method of injection, we can't feel the very little small branch, and for the understanding, of course, the small branch, because mainly they have sometimes the great importance for the result of surgical operation. There can be used the modification of the injection method, method of the corrosion preparation. What does it mean? The same thing. The blood vessels or the lymph vessels, maybe vascular system or lymph system, is injected by special contrast material. This material cannot be solved in the acid. After all, especially it's important for understanding the vascular system of the parenchymatous organs like the liver, spleen, or kidneys. The vascular system is injected by the special material. Then the organ totally is placed in the acid, and of course the organ is solved, but the vascular system is retained. The corrosion method, it's the primarily 3D information of the vessels can give you. And yes, in this slides you are looking at the pictures of the Professor Nikolai Pirogov. Main works is the ligation vinculum of abdominal aorta, easy and the non-dangerous operation of inguinal aneurysm. Also, he wrote the surgical anatomy of vascular trunks and fascia. Please attention, the special attention to the vascular trunks and the fascia, because as I have noted, the fascia form the vagina, form the thread for the vascular trunks of the concerned region. Complete course of the applied anatomy and the atlas of topographic anatomy in cross sections through frozen cadavers. It's the main work of Professor Nikolai Pirogov. And one of the prominent topographic anatomists was Professor Viktor Shevchenko. The main works of Professor Shevchenko are the theory of individual anatomical variability, because as I have noted, the topographic anatomy is very close to the clinical practice than the descriptive anatomy mainly gives you the basal knowledge, and it's the more theoretical science. But by this way you are looking at it, we have deal with the concrete person, not the middle average person. Concrete person with the several lengths of his body, several mass, and vascular system, nervous system, organs, muscles. They are same like you have been studied in your anatomical textbooks, but each body has the special features, and from here we can get the term of anatomical variability. It's norm. All variations form the norm for the concerned organ. And then Professor Shevchenko continued his investigations in the age and typological anatomy in 1925. Course of the operative surgery and topographic anatomy, and atlas of the peripheral nervous and the venous systems is the following investigations. You know, the topographic anatomy is just a step, but a very important step to surgical practice. Then you will study the surgery, operative surgery, or the general surgery, and the surgical diseases. And in your case, for your faculty, you will study the oral or the maxillofacial surgery, and there are many important, very important textbooks and also video materials about the providing of the unique operations on the face. And from this point of view, the topographic anatomy studies the structures of the human body on cross sections in application to clinical diagnostic, ultrasound images, computer tomography, and MRI, magnetic resonance. These are the tomographic two-dimensional slice images. Imaging technologies using X-ray, ultrasound images, CT, MR, and the radioisotopes can give the precise anatomic delineation and as well as function. It's very important because all these modern methods which are used in the clinical practice mainly are the topographic anatomic methods, because at the base, at the foundation of all these methods is the studying of the mutual arrangement of the organs. Of course, the surgical anatomy, it is the very important branch of the anatomical science. It studies the structures of the human body from the surgical point of view. That is their importance to the performance of incisions and operative methods. Yes, if the topographic anatomy begins this process, it exactly defines the position, location of the structures, vessels, nerves, their way, direction, the three-dimensional position of this organ, give you the exact information about this region. Surgical anatomy gives your way how you have to perform your incisions, your cutting, all these operative methods. For example, tomy, stomy, ectomy, resection. So ectomy is the ectomia, removing the whole organ. Tomy means just removing of part of this organ. This also means a study of anatomical variations in the preparation for structural differences encountered at the operating table. Again, you are looking at the main use of the anatomical planes is to describe the sections. In this figure, sections of the limbs by topography. Sections may be obtained by anatomical sectioning or medical imaging techniques. Longitudinal section, transverse section, or oblique section. You can realize that the Pirogov's method of the using of frozen cadavers was very important for the 19th centuries. It's very great. It was the great idea studying the human body in the frozen cadavers, because in the frozen, for example, frozen meat, if you cut it, you can cut at any place to any direction, and you will get the position of underlying structure. As I have noted at the beginning part, layer by layer, studying the layer by layer. Of course, the skin and the underlying structures such as the subcutaneous tissue, they are very important to providing operation and a very important part of the human body as our hand. Yes, we will have the special lecture about the topographic anatomy of the upper limb and also the hand. In this picture you are looking in the A, the thickness of the subcutaneous tissue can be estimated as being approximately half that of pinched fold of the skin. It means the fold of the skin includes the double thickness of the subcutaneous tissue. The dorsum of the hand has relatively little subcutaneous tissue. On the B, you are looking the long, relatively sparse skin ligaments allow the mobility of the skin demonstrated in the part A. Many skin underlying the subcutaneous ligaments. This kind of the ligaments you will find also on the face. Retaining ligament, now by the new anatomical, aesthetic, surgical investigation, these ligaments are called the retaining ligaments. And at C, you are looking at the skin of the palm, like that of the sole, is firmly attached to the underlying deep fascia. Yes, cadaveric dissection of the face is important, and you are looking at the on this picture at the cadaveric dissection of midfacial fat compartments with subsequent coloring of the deep facial fat compartment. Of course, for better illustration, the levator labis superioris muscle in this picture has been removed to expose the deeper located fat compartments. White ropes indicate the location of the orbicularis retaining ligament and the zygomatico-cutaneous ligament. We are looking at the retaining ligament at the orbicularis regio, zygomatic regio. You are looking at the zygomatic muscle. That one moment we have to note the deep medial cheek fat is located between the angular vein laterally and the infraorbital foramen medially. Again, it is not only anatomical dissection, it's topographic dissection, because in this, for example, in this preparation, you have to study the mutual arrangement, or simply saying the relation, neighboring organs, close or distant, the relation between the organ to vessel, part of the body with the all underlying structures, of course. Again, in this picture you are looking at the layers of the perioral musculature, even the mimic muscles of the facial expression. They have the very important organization. The yellow first layer muscles, for example, orbicularis oris. The blue is the second layer, and the pink is third layer, purple fourth layer. Even the underlying, the skinny muscles, topographically, they form the 4 layers for the face. Again, in this picture, you are looking at the layer 1, layer 2, layer 3, and the layer 4. By the studying this picture because it's your future subject, your future job, the plastic surgeon, and you have to study topographic anatomy very well. Excavated section of the leg demonstrating the deep fascia and the fascial formation. For example, fascia or the fascias constitute the roping, packing, and insulating material of the deep structures of the body. Underlying the subcutaneous tissue, superficial fascia, almost everywhere is the deep fascia. The deep fascia is a dense, organized connective tissue layer devoid of fat that covers most of the body parallel to deep to skin and subcutaneous tissue. Extensions from its internal surface invest deeper structures such as individual muscles, when it may also be called epimysium, and the neurovascular bundles as investing fascia. Its thickness varies widely. For example, in the face, distinct layers of the deep fascia are absent. Here's the division of the head into the region regiotemporalis, frontalis, orbitalis, mentalis, and so on regions. They are separated. We cannot separate by any way. No, all these regions they have the conditional or the natural, the limiting lines. Again, the structures of the head, the mutual location arrangement on the middle cranial fossa and the part of the eyeball with nerves. Several rules in topographic anatomy are very important. You have to know what is the less important, especially example grazie, regarding life function is more superficially located. It explains why the arteries are more deeply than the veins and the trunks of the nerves more deeply than the small nerve branches. Important structures are deeper. Again, you are looking at the regions. Rule number 2: many structures have always close relationship. Yes, it is the foundation. It's, if you want, its idea of topographic anatomy. The vessels are usually accompanied with the nerves, and they form the neurovascular bundles, such as the nervus, arteria, and vena femoralis. Blood vessels, I mean the arteries, veins, and lymph vessels, pass through the body together, not by separate way. And of course, the individual variability. For example, facial artery, like in this picture, facial artery gives the inferior labial artery, then it has the course to the nasal wing, but then it gives the superior labial artery. Superior labial artery in the second case give the branch to the deep part of the nose, and it is formed at the same point with the angular artery. Facial artery gives the inferior labial artery, superior labial artery, and no angular artery. But the angular artery, it is very thin and goes to just the lateral wall of the nose. All these moments must be at the center of the studying of topographic anatomy, which is if you want, the center, main part of the clinical anatomy. Head and neck anatomical regions, thorax and anatomical regions, dividing into the regions. It's our references, all the literature sources which we used during our lecture. Thank you for attention.